Hello, my name is Sydney Nikolai. It is May 5th, 2024. This is my note sheet, and I'm going to be doing my first presentation. The definition of a disease is a deviation from homeostasis. You always want your body to be in homeostasis. That is like the absence of disease when the body is in homeostasis. For this presentation, I will be using Parkinson's disease as an example. So in Parkinson's disease, dopamine neurons are affected in the brain and they are not functioning properly. So they are deviating from homeostasis. Etiology of a disease are the causes of the disease. So in Parkinson's disease, it could be genetic, which means it's passed down through generations, through bloodlines, through the genes itself, or it could also be environmental. So in Parkinson's disease, pesticide exposure, it can damage the dopamine neurons and cause this disease. Signs and symptoms. So a symptom is a subjective feeling from the patient. So this is something like a headache, a stomach ache, they feel sweaty, stuff like that. So in Parkinson's disease, they can feel slow overall, stiff, they can have a lack of coordination, or they can feel tremors occurring in their body. So the patient is saying this to the medical provider. A sign is something that can be measured from a medical provider. So something like temperature or blood pressure are some common things, or any sort of vitals are all signs that can be measured. So in Parkinson's disease, one that I find interesting is urinary dysfunction. So they can measure urinary output to see if there is any dysfunction or deviation from homeostasis. A syndrome are all of these signs and syndromes, a syndrome are all of these signs and symptoms all put together. So they clinically manifest to put a disease into like a specific category. So for example, Parkinson's disease is a neurodegenerative disease. A diagnosis is what the patient themselves has. So some things that are important when looking at a diagnosis of a patient are things such as family history, previous and current medical history, clinical manifestations, a physical exam, and various diagnostic tests. So Parkinson's disease is a little bit sometimes difficult to diagnose because of the slow progression of it, but also if a patient is showing all of the common symptoms, it can be pretty straightforward. So it just varies on how the disease is progressing for the specific diagnosis. Sometimes they might be referred to like a movement disorder specialist to get this diagnosis, or any other sort of specialist for different diseases. Complications are medical problems that occur to the patient. So again, can be any sort of complication is a deviation from homeostasis. Homeostasis is so big and important when talking about diseases. So some common complications for Parkinson's disease are just thinking differently, depression, swallowing problems, mood swings, constipation, and sleep problems. All of these things can be very, very difficult for the patient and can make the disease very difficult to treat. Prognosis is the assumption of the results. So based on previous cases of a disease, where the patient is going to lie in how long their life expectancy is and the quality of life that they will live. So Parkinson's disease is a degenerative condition, but still most people are able to live normal lives with medication and different therapies such as speech, occupational, and physical therapy. Diagnostic tests are medical tests that help diagnose based on signs and symptoms. They can show signs for the medical provider. So in Parkinson's disease, some of the diagnostic tests that are commonly used are CT scans, X-rays, MRIs, fMRIs, which are functional MRIs, biopsies, and genetic tests. So I enjoyed this presentation. Thank you for listening and learning about Parkinson's disease.